Many patients try to put off cataract surgery because they're nervous about it. And that's exactly the wrong thing to do. First off, and the reason that's wrong is that the way cataract surgery is performed today is with the use of sophisticated ultrasound. That is, an ultrasound instrument actually dissolves the cloudy lens in the eye. And if we think about cataract surgery as a lens exchange, what we do is we take out the cloudy lens and replace it with a clear artificial lens, an implant. A lot of people don't realize that we use implants during cataract surgery too. Now, the problem with putting off cataract surgery is that as the lens becomes cloudy, it also becomes firmer or harder. Because of that, that means you're going to need more ultrasound energy during the cataract surgery in order to remove that cloudy lens. And it would be possible that you put off your cataract surgery so long that you might increase the risk of having a complication develop during surgery because you're using greater and greater amounts of energy in order to remove that cloudy lens. So we don't really do cataract surgery on everybody that has a cataract. It has to affect your lifestyle first before we proceed with surgery. But there is a problem if we start putting off cataract surgery too long because it may decrease your chance of success from the procedure. The procedure is an outpatient procedure. That is, you don't have to stay overnight in the hospital. Typically what happens to the patient is they'll come into the outpatient surgery center about an hour or two ahead of time. We put an IV into the arm or hand to give you some medicine to relax you, and we actually numb the eye with anesthetic eye drops. Patients lay flat on their backs and they're covered with a paper drape. During the procedure, a bright light shines on the eye, and what a patient experiences during the surgery is just they see a lot of colored lights and shadows during the procedure. The typical procedure lasts about 15 minutes, and then the patients go into a recovery room where they're monitored, their blood pressure and pulse and so forth, and then they go home. Even after the anesthetic drops wear off, it's generally not a painful procedure. What most patients will experience is that they're going to be a little blurry because their pupils are dilated for a few hours afterwards. And as the anesthetic wears off, the eye may be a little scratchy or burny, but typically there's not a lot of pain involved with the cataract surgery. It has a very high success rate. 98% of people see better after surgery than before, and the recovery period is very short.